Hi there, it's Dr. Atkinson. Today we're going to take a closer look at one of the most common and most contagious illnesses, viral rhinitis, more casually known as the common cold. What is viral rhinitis? Viral rhinitis is the most frequent viral infection in the general population. We often use the term common cold to describe this condition. It's usually self-limited, caused by a virus, and affects the nasal mucous membranes, which is why symptoms center around the nose and throat. Now, technically, rhinitis means inflammation of the nasal cavity, while URI, or upper respiratory infection, is a broader term that might include pharyngitis, laryngitis, or tracheitis, depending on the affected area. Colds are highly contagious. In fact, people shed the virus up to 2 days before symptoms appear and continue to be contagious early in the symptomatic phase. That's why colds spread so easily in schools, workplaces, and crowded public areas. What causes it? The common cold is caused by over 200 different viruses. The most common culprit? Rhinoviruses. These tend to spike in early fall and spring. Other viruses like coronavirus, adenovirus, respiratory syncytial virus, RSV, influenza virus, and parainfluenza virus can also cause colds. And here's a key point. Many of these viruses have multiple strains, so people can get sick repeatedly throughout life. That's also why we don't have an effective vaccine for the common cold. There are just too many versions to target. Some strains, like SARS-CoV-2, can cause more severe symptoms and fall outside of your typical cold, but they're still part of the same viral family tree. Contrary to popular belief, you don't catch a cold from cold weather or being out in the rain. The real reason colds are more common in winter? Viruses survive better in low humidity, which is typical of colder months. Symptoms to watch for. The clinical manifestations of viral rhinitis are familiar to most of us. Low-grade fever, nasal congestion and runny nose, rhinorrhea, sneezing, a scratchy or sore throat, halitosis, bad breath, watery eyes, general malaise, chills, muscle aches, and sometimes headache. As the illness progresses, a cough usually appears. Symptoms typically last 1 to 2 weeks. If more severe systemic symptoms develop, like high fever, chest pain, or difficulty breathing, it may have progressed to another condition and no longer qualifies as simple viral rhinitis. And here's an interesting complication. Colds can reactivate herpes simplex virus in some people, leading to cold sores or herpes labialis. Cold sores, herpes labialis. Let's pause to talk about herpes simplex virus type 1, HSV1. This is what causes those painful little blisters around the lips and mouth, often referred to as cold sores or fever blisters. HSV1 is highly contagious, often transmitted in childhood, and can lie latent in the body for years. Things like stress, illness, or sun exposure can reactivate it. Symptoms include a burning or tingling sensation before blisters appear, clusters of small, fluid-filled vesicles, lesions that eventually crust over and heal with pink skin underneath. Treatment includes antiviral medications like acyclovir or valacyclovir, topical anesthetics, and sometimes occlusive ointments like docosahexaol. Educate patients to begin treatment at the first signs of symptoms and to avoid oral sex or sharing utensils during outbreaks, especially because HSV1 can cause genital herpes through oral genital contact. Treatment and management of the common cold. Here's the key. There's no cure for the common cold. Treatment is all about supportive care and symptom relief. Standard home care instructions include fluids and rest, warm saltwater gargles for sore throat, NSAIDs like ibuprofen or aspirin for aches, antihistamines for sneezing and runny nose, petroleum jelly for chapped nostrils, expectorants like guaifenesin to help loosen mucus. Antibiotics should not be used for viral rhinitis. They won't help and can increase the risk of antibiotic resistance. Topical nasal decongestants like phenylephrine or oxymetazoline should be used with caution. If used too long, they can cause rhinitis medicamentosa or rebound nasal congestion. You'll also hear patients ask about zinc lozenges, echinacea, or steam inhalation. While these are widely used, evidence for their effectiveness is mixed at best. They're generally safe, but be honest about the limited benefit. Nursing considerations. As a nurse, your role includes not just symptom education, but infection control. Teach proper hand hygiene. It's the most effective prevention. Remind patients to use tissues or sneeze into their upper arm, not their hands. Explain that colds spread through direct contact, droplets, and even airborne particles that can linger for up to an hour. Also, make sure patients know when to follow up. For example, if symptoms last more than 2 weeks, worsen, or lead to new complications like sinus pain or high fever. Provide both verbal and written instructions for symptom management, especially for high-risk groups like older adults, children, or the immunocompromised. Final takeaways. Let's summarize. Viral rhinitis is a self-limiting, contagious infection caused by many different viruses. Symptoms are familiar and typically resolve in 7 to 14 days. Treatment is supportive only. Antibiotics aren't effective. Education, hygiene, and appropriate use of medications are key nursing priorities. And don't forget, cold sores may show up during viral illnesses due to HSV1 reactivation. That's it for today's lecture on viral rhinitis. I'll see you in the next session. And remember, fluids, rest, and wash your hands.